Health and Human Services Secretary Robert F. Kennedy Jr. announces another shakeup in America's vaccine policy. Fox's Madeline Rivera has more on the change and the criticism Kennedy is facing.
Vaccine policy is changing quickly under HHS Secretary Robert Kennedy Jr. In recent months, he's ousted members of the Vaccine Advisory Committee and banned outside experts from working with the CDC on vaccine recommendations. Now, the secretary has signed off on a ban on thimerosal, a mercury-based preservative often used in American-made vaccines, claiming it's been linked to miscarriages and autism in kids.
Regulators should never have allowed mercury in any vaccine, especially those given to children. They had the science, but they chose to ignore it.
The new ban is part of an ongoing attempt to reshape how vaccines are approved and administered and who can get them, with RFK Jr. hinting more than once that he's considering putting restrictions on future vaccine recommendations, including for flu and COVID.
The days of ignoring the science are over. The days of putting profits ahead of people are over. We are remaking FDA and CDC under President Trump's leadership.
But there's been a big pushback. Most scientists say there's no link whatsoever between thimerosal and autism, and Democrats on Capitol Hill are now calling for an investigation into Kennedy's vaccine policy.
There have been persistent falsehoods about vaccines continuing to harm our communities, and this misinformation is compromising research into the very harms that we need to prevent.
Secretary Kennedy also repealed federal rules requiring hospitals to report the vaccination rates of their employees. In Washington, Madeline Rivera, Fox 9.
Wisconsin is reporting the first cases of measles in the Badger State this year. The Wisconsin Department of Health Services has identified 9 cases in Oconto County, which is just north of the Green Bay area. The first was identified through testing. The other 8 cases confirmed based on exposure and symptoms. Officials say exposure comes from a common source during out-of-state travel. Measles symptoms usually appear about 10 to 21 days after exposure.